And I wanted to point out just a few things to be clear of is that while we're really focusing in on how important it is to scale up the science, to educate our communities, to appreciate those who have been involved in clinical trials and in demonstration projects, but to make sure that that extends to people in the everyday world, in their real lives, in the rural communities, in invisible communities, in some of those vulnerable spaces that we might not even be recruiting all of the folks who are needing it the most into the trials, is that at some point we also have to be very clear and conscious of the individual choice in terms of treatment and access to treatment and what kinds of treatment work for them in their real lives. That we have to be clear that while we have wonderful clinical access, that we also have best community-based delivery of the information as well as the access to these services. We're all wrapped around the care continuum and also looking at the cycle of prevention and treatment in that continuum, and that those components of the care continuum are those things that are going to help us get to the 90-90-90. But at the same time, we have policies, we have practices, we have all kinds of forces that may impede all of the wonderful success that we have with the science. I mean, just now, looking at the Transnational Pacific Partnership and what those trade agreements will mean in terms of countries being able to have access to the affordable drugs that we need, making sure that we increase the role of the engagement of young people and women and people of African descent around the world in terms of their engagement in their own care as individuals, engagement in partnership with the scientists and clinicians, but also engagement in community action to make sure that what their communities need is what we get. An example I give you is that in my own home state of Georgia, which is actually increasing in the numbers of HIV incidents in certain populations, especially young Black men who have sex with men and young women. In my state, we don't have Medicaid expansion. We don't have universal health coverage for those who need it the most. And so these treatments will mean not much if there's not a system to deliver that care. We also are finding that we have large increasing numbers, especially of young Black people who are being diagnosed with stage 3 diagnoses at the same time as their first HIV diagnosis, which means that testing earlier and getting into treatment earlier is also extremely critical for many of our most vulnerable populations. I call criminalization stigma on super steroids, so that we actually have to deal with the issues that not only are we addressing stigma, but that in places where our sex, our gender, our identity, and even our love are actually criminalized are also huge impediments to our ability to implement all that works with the science that we've discussed so far. I mean, there's something that I noticed in our Vancouver consensus statement, which I'm really proud to have been a part of help crafting, helping mobilize, and helping you all get the word out. But now that we have that consensus on the biomedical and clinical science on how to defeat the virus in the bodies of people living with HIV and those at greatest risk, we also need to ramp up the consensus on the social and behavioral sciences of how to defeat the stigma and discrimination, the fear and the shame, the invisibility and the exclusion of those most vulnerable. I also want to make sure, for example, that as researchers and scientists, clinicians, advocates, activists, decision makers, and donors, that we've reached the consensus, right? That we have demonstrated the science works. We say, I think that we're pretty sure that we care about what the numbers tell us about how good the science looks. But what we want to be damn sure of is that we care most about what the people say about how good the science works in our lives. And so I actually want to, again, applaud the science, but also to keep us conscious and aware, and with some level of cultural humility of the practices that actually play out on the ground, that as we say at the end of this consensus statement, that science has delivered the solutions. The question for the world is, when will we put it into practice? I flip that just a little bit and say that science has delivered us some of the biomedical solutions. And when we solve the rest, it will not only mean that we have begun to put it into practice, but that we are dedicated to making it perfect.